I'm a physician who sees patients only in the hospital setting. This is where you will find our most complicated patients. While the electronic medical record allows physicians to quickly access vast amounts of data in order to better manage patients, analysis of all this information and documentation of these encounters has become more difficult and time-consuming. That being said, physician documentation not only gives the care team a clinical picture of the patient's situation, but is also used to assign administrative codes for billing and patient acuity.
Because of the time it takes, physicians often do not document with sufficient detail to allow medical coders to capture the severity of the patient's illness or the acuity of treatment. Currently, we rely on clinical documentation specialists to periodically review charts. They remind physicians where they need to improve their documentation. What Health Tensor is creating will improve physician documentation in real time to ensure accurate coding.
This will save physicians time documenting, allowing us more time with our patients.
Please allow us to introduce Health Tensor.
Hi everyone, my name is Eli Ben-Joseph, CEO of Health Tensor. I've been working with computers my entire life. I made my first website when I was 12, and I built my first computer when I was 13. I've also had a profound interest in medicine and science. In fact, a few years ago, I was deciding between going to medical school and getting a master's in computer science. In my mind, those career paths looked vastly different. One looked like this, while the other looked like that. However, after spending some time volunteering at a hospital, I realized that the view that I have of what physicians do was completely wrong. The amount of time that physicians spent hunched over their computers doing documentation was astonishing. For every hour that a physician spends with a patient, they have to spend 2 hours on their computer. Their job is starting to look a lot like mine. Physicians certainly did not go to medical school to spend more time on the computer than with their patients. The problem is, without proper documentation, physicians don't get paid. But with only so many hours in a day, it's not surprising that physicians choose to sacrifice documentation rather than time with their patients. Unfortunately, sacrificing documentation leads to lost revenue for those physicians and the health systems that they work for, something to the tune of $10 billion per year. At Health Tensor, we're developing artificially intelligent systems that automate documentation. Starting with hospital patients, our technology mines the medical record for pertinent information, diagnoses key conditions, and generates proper documentation, all ready for physician review. By automating documentation, we can save physicians hours per day. Not only that, but we improve care team communication, reduce physician liability, ensure compliance, and optimize appropriate reimbursements. There are some big players trying to improve documentation, but they're doing it too late in the workflow. They're trying to clean the mess after the doctor has already written the note. Health Tensor deals with the problem at the source by working with physicians at the front line. This allows for more accurate documentation, saving hours of manual review, trying to determine what care was actually provided. To build a product as advanced as this, it takes the right team. Our team is comprised of experts from MIT, Stanford, and UVA with deep experience in software, artificial intelligence, and data science products. So far, we have worked with physicians to develop 5 algorithms that diagnose and document specific conditions. These algorithms have identified 600 cases of undocumented complications at Cedars-Sinai last year. With our technology, Cedars-Sinai would have added an incremental $500,000 in reimbursements for just these 5 algorithms. When we have 100 running, that's up to $10 million per year for Cedars-Sinai, and it saves physicians time. Building a full product that encompasses every medical condition requires a strong partnership with world-class physicians. As a result of our work thus far, I'm proud to announce that we'll be partnering with Cedars-Sinai to develop our tools alongside their clinicians and coding experts. Thank you. We're Health Tensor, and we're building products that allow for proper documentation. allowing physicians to get back to doing what they do best rather than what we do best. Whether you're a frontline provider or you manage billing and coding, we can help reduce the burden of documentation. Find us online at healthtensor.com, and we can show you how we can improve physician satisfaction while maximizing reimbursements. Thank you.